Hey folks, Dr. Moji here, and I want to share with you your spinal hygiene exercises. That way you get the most benefit out of your care and the most benefit out of these 4 exercises. But before we dive into the 4 exercises, what I want to dive into is what all anatomy textbooks all agree on. And so when it comes to your spine has to have full range of motion in all segments. Okay, so that's a given. The other is the muscles. They have to be equal. They have to have symmetry. You can't have one side tighter than the other side, creating a abnormal pull of sorts. Then third, we all agree on is the curvature. You have to have that lordosis in the cervical spine, a kyphosis in the thoracic spine, and then another lordosis in the lumbar spine, allowing you to have that proper shock absorption. Now, as we dive into the 4 exercises, before we do that, let's talk about ice for a second, because when you are subluxated, when you are misaligned in the spine, there is inflammation. There's inflammation in the disc. There's inflammation in the ligaments and tendons that hold everything together. But of course, there's inflammation in the facet joints, the articulations of the spine. And so the best way to overcome that, combat that, is through ice, an ice regimen, icing your neck and icing your low back, allowing the inflammation to go away naturally without the use of ibuprofens and Tylenols and things of that nature. So the research says 10 to 20 minutes is going to be your best time frame. Going beyond the 20 minutes, there's diminishing returns and it's not as useful. So stick with about 15 minutes 3 times a day, and that will really drastically reduce the inflammation and help your spine recover so much faster and getting you the best results possible. Now, let's dive into the 4 exercises. The first one, and I want you to start with first thing in the morning, and that's your range of motion exercises, getting all the ligaments and tendons freely moving in all directions. So you have 6 cardinal movements. So let's go over those. You have flexion, you have extension, you have lateral flexion, you have lateral flexion to the other direction, you have rotation, and you got rotation. So there's 6 movements. Of course, we just did the neck, and I want you to do, of course, the low back as well in these morning sessions. Hold each position for about 15 to 20 seconds, and that will freely allow your ligaments and tendons that hold everything together in your spine. You can see all the attachments. That's where ligaments and tendons and muscles attach to. So by freely moving those, that will drastically help with your range of motion. The problem with society, with utilizing computers or whatever work endeavor you have, we have asymmetry. So let's use the example of a farmer who's always looking to their back right tire, making sure that their crops, their rows are all in line. Okay, so we all have these asymmetrical movements. Take years ago, a telephone operator, always having their head cocked. Of course, that's going to cause distortion in the spine. Now, the second exercise is involving this beautiful wobble disc. And so I'm going to sing to you. That way you remember, okay? And so you wobble to the left, you wobble to the right, you wobble, wobble, wobble till you sit upright. And so with this exercise, we're focusing on a term called imbibition. Simply put, it's pumping of the disc. And so if you are old like me and you're above 20 years old, the disc, the ligaments and tendons are now avascular. What that means is it's without blood. Those cartilage fibers are without blood. Now, just to recap some anatomy, what is blood for? Blood is for delivering nutrients to cells and tissue and taking metabolic waste out and doing that cycle process, okay? And so without blood supply, something will rot, it will decay, it will die. For example, like a heart attack is a cutoff of blood supply to those muscles of its own heart, right? And so it's not getting the nutrients that it needs, and so then that piece of the heart decays and dies. So it's a little concerning. It's like, why do we not have this blood supply to our disc, especially? Aren't they important? Well, how God made us is by pumping the disc, by imbibition, by movement, we can get metabolic waste out and nutrients in. And so it can have this ebb and flow. The problem is when you are subluxated, when you are misaligned, those joints get stuck and then there's no more movement. So what this exercise simply does is it encourages movement, especially in the lumbar spine, L4, L5, L5S1. Those two discs are highly sensitive to disc bulges, disc herniations, throwing out your back. That's really predominantly where that's going to happen. And so I want you to go through this exercise. You're going to left and right about 10 to 12 reps, forward and back about 10 to 12 reps, and then circular, both clockwise and counterclockwise. That will drastically help the improvement of your disc. And it's a great warm-up to your adjustments as well. And warming up the spine before you get adjusted is very simply like warming up before you do an exercise. So let's move on to the third exercise, and that involves more your neck strengthening. We're going to utilize this TheraBand here, but the purpose of this, what I want to achieve here, is strengthening the longest collie muscle. It is a deep neck flexor. It's right in here, and it helps with our posture, brings your head back. If you ever go to the store and you see someone slouched over and they have their neck forward, anterior head carriage, or text neck is what we call it, and then they have this dowager hump here. What we want to do, how we want to do it, and I'll show you, is you take the TheraBand, okay, in your hands, and you can change the gripping, but you can put it behind your head, and then before I dive into it, you want to have perfect neck position in order for this to be successful. So pretend like there's a wall coming towards your face and you want to go straight back. You're going to give yourself a double chin. And then now that you have that maintained, you're not going up, you're not going down, you're going straight back. Now you put the TheraBand behind your head and you just extend your arms. You're not moving your head at all. And you come back and you extend your arms and you come back. You're going to do about 12 reps. This isn't a big muscle building movement. This is a movement that's more for postural muscles. We want to wake up that muscle, that longest collie muscle. That way, when you're out in the garden or you're working at your computer at home, you have better posture. That way, you're not continuing to deteriorate your spine. And so it's a very simple exercise. So wobble disc a couple times throughout the day, TheraBand exercise a couple times throughout the day. Lastly, the fourth exercise is the molding roll. So you have black cylinder tubes and you have two of them, and I want you to lay on them. Okay, one behind your neck, one behind your low back, and of course we're going to walk you through the placement of that and making sure that you have it just right. That way you can work on those curves like we've mentioned before with the spine. So with those curves, you have better shock absorption and longevity of your spine, reversing degenerative disc disease, because degenerative disc disease starts with a subluxation and a loss of these curves that we're talking about. Now, with these spinal molding, I want you to do them on your bed, not on the floor. The reason why the bed will give you some more give and it won't be so aggressive, because we're looking for gentle changes. We're looking for consistency. I always tell folks, you're not going to, spend an hour once a week brushing your teeth. You're going to consistently brush your teeth, once or twice a day, hopefully twice a day, but for about 60 seconds, 60 to 90 seconds, right? So that's the same concept I want you to have with these spinal molding exercises. Is you're going to lay on your bed at the end of the day and you're going to work on that curve of the neck and the curve of the low back. These are the lordotic curves. Reason why at the end of the day is because your discs are more fluid. Okay, so as you've been moving around, going out throughout your day, your disc will become more fluid and less rigid, so it's more susceptible to molding exercises. That way you get the most benefit out of the time spent. So I'm looking for about 3 to 4 minutes, maybe even 5 minutes, and even Ryder loves his spinal hygiene exercises. So I hope this was helpful, and I hope it was informative. If you have any questions, obviously reach out to us, ask me, because this will drastically improve the quality of your care and your results at the end with your x-rays. So love you guys, and I'll see you soon.